Dr. Worley from Total Health Systems, and today we're going to talk about discs. All right, so we're going to imagine that our spine is a tower of vertebrae, so stacked on top of each other, with small jelly donuts in between each bone, and we call those discs. So the gooey insides of that disc, would be the jelly of a donut per se, is called the nucleus pulposus. It's largely made of water and kind of makes it so it can move around a lot easier. The outside, or the doughy ring of a donut, is called the annulus fibrosus. It's made of cartilage. It makes the disc nice and rigid. It allows it to sustain forces and do things that prevent everything from going awry in our back. Right, so both of these serve important functions, from cushioning forces like gravity or weight on our spine, as well as allowing spinal movements in all different directions. All right, so now we're going to look at some things that can kind of happen to your disc, some issues that may arise or things that can occur over time. So I'm going to start with disc bulges. So what this is, the disc kind of pops out a little bit. There's a bulge in the fibers of the disc, so the jelly of the donut per se gets pushed out into that doughy ring, causing a little bit of pressure out into the space there. And oftentimes this can occur from too much weight on the spine, injury to the area, and oftentimes they're painless, but they can lead to irritation, stiffness, or even a pinched nerve. The secondary and probably more severe one is called a disc herniation. So this is that pressure that is causing that bulge, and the jelly bursts out of that hole in the donut, creating a lot of inflammation, a lot of issues around that disc, around the nerve as well in that joint. Right, so it affects the nerve, affects the joint, and can lead to a lot of pain and discomfort. This is that one where you kind of lean over to pick up a pen off the ground, you hear a sharp pop, and all of a sudden your low back falls out, and you're like, oh, that's not great, right? So as it pushes out, it kind of depresses that space a little bit, so the vertebrae go on top of each other a little bit more, and there's less space in there, creating more pain, discomfort, and that's where you get that pain shooting down the leg and just doesn't have a great time with you. The next one, the last one, is called degenerative disc disease. So that scary term that likes to get thrown out a lot, that scares a lot of people with arthritis and everything, is I just call it gray hair of the spine, right? So over time, our discs lose height and shrink. You know, it's much like a donut you've left out for too long. It just shrinks, hardens, and doesn't move as well as you think, or it doesn't taste as good as you want it to, right? So that just happens. That's part of living life. It's part of what we do. Right, so it may lead to less space between your vertebrae. You might get a little shorter. It may increase stiffness in that spine, which is why we can't bend as well over time, or as we get older, we don't bend and move as clean, right? And it may lead to pain, discomfort. It doesn't have to. It's just like getting gray hair. Everyone tends to get it, but it doesn't have to be a painful experience. It's just part of living life. It means that you've been living well and doing a lot of things. But should it create issues, should it create stiffness, that's something that we can absolutely help and create more movement through those areas. All right, so the bad news is that it is inevitable. All right, the good news is it doesn't have to be painful. It's a normal part of aging, but staying active, eating well, staying hydrated, and keeping the discs healthy, and it can maintain them and stay stable for many years. What also kind of helps is, well, getting adjusted, going to the chiropractor, going to physical therapy, making sure all of these things are moving properly, making sure the discs are healthy and to their highest potential. And so if you want to stay up to date with keeping your body nice and healthy, I suggest you hit that subscribe button and check out more videos just like this.